as we go into nursing plan of care for acute leukemias, the first of which being acute lymphocytic leukemia or ALL. The nursing diagnosis chosen was risk for infection related to overproduction of white blood cells as evidenced by increased multi-segmented neutrophils. So the first nursing goal is that the patient will utilize practices to protect major sites of infection. Nursing interventions related to that goal will be patient will practice adequate oral care daily, and patient will utilize daily showers and cleansing to prevent skin breakdown, since the skin and the mouth are big sources of infection for these patients. The second nursing goal is that patient will be able to verbalize infection prevention practices, and nursing interventions related to that, patient will explain the proper hand washing technique and when it should be utilized. Patient will explain the necessity to avoid large crowds and that they will wear a mask and avoid sick contacts, all important infection prevention practices. When we look at acute myelogenous leukemia or AML, the nursing diagnosis I chose was fatigue related to anemia, infection, and deconditioning, as evidenced by expressed feeling of lower than normal energy levels and inability to maintain normal activities or their normal ADLs, activities of daily living. The first nursing goal related to this is that the patient will discuss what they think makes fatigue worse. Nursing interventions related to that is that we can trend the hemoglobin with levels of fatigue. This patient might need a higher hemoglobin threshold to uphold their ADLs. Also make accommodations to promote restful sleep when the patient is admitted to the hospital, decreasing stimulation overnight, and utilizing lights and natural light during the day to promote adequate sleep-wake cycles and decrease fatigue. The second nursing goal is that the patient will demonstrate 2 energy-saving techniques to help decrease fatigue overall. Nursing interventions related to that, the patient will utilize adequate nutrition and will have small, frequent meals throughout the day to increase energy levels. And the patient will engage in daily activity to help increase energy levels and lessen fatigue. Physical therapy and nutrition consults will be important for that intervention.